Hi, this is Dr. Michelle Woolhouse. Join us on FX Medicine next week, where we'll be talking to Beth O'Hara to chat all things MCAS. Subscribe to us on your favourite podcast app and follow us on social media to make sure you never miss an episode.
Hi, and welcome to FX Medicine, where we bring you the latest in evidence-based, integrative, functional and complementary medicine. FX Medicine acknowledges the traditional custodians of country throughout Australia where we live and work, and their connections to land, sea and community. We pay our respect to their elders past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Joining us on the line today is Dr. Helena Popovic. Helena is a GP, award-winning author and international speaker who shows people how to boost their brains at any age or stage of life so that they can perform at their peak on a daily basis and avoid Alzheimer's and other dementias in their latter years. Having shared her mother's journey with lung cancer and her father's adventure with dementia, she speaks from a personal as well as a professional perspective. Dr. Helena graduated from the University of Sydney and has done extensive research in Alzheimer's prevention and disease modification. She is the author for a number of best-selling books, including Can Adventure Prevent Dementia? A Guide to Outwitting Alzheimer's, which we're going to delve into further today. Helena is also a Sydney TEDx Fast Ideas finalist and a popular TV and radio commentator. Welcome to FX Medicine, Helena.
Thank you very much, Lisa. I'm thrilled to be speaking with you.
Oh, we're so excited to have you with us today. So dementia is an umbrella term for a range of different conditions, including Alzheimer's, vascular dementia and so on. And all of these can cause damage to the brain, which then affects factors such as memory, thinking, language and mood. It's also the second leading cause of death in Australians. And while this may sound very disheartening, if we look at the flip side, what I think many people will be empowered to know is that the research suggests that 40% of dementia cases may be preventable through modifiable lifestyle interventions, highlighting what you explained so well in your book, that we can be proactive about making changes to our brain health at any age if we get our diet, mindset and lifestyle right. So you state in your book that a diagnosis of dementia is made every 3 seconds. And I was reading that in 2025, close to 340 people will be diagnosed every single day. Can you tell us why you think we're seeing such high numbers and the underlying pathophysiology as to what might be going on?
Okay. It's definitely not just because we're living longer. I believe it's because we are living in a toxic world. And by toxic, I mean everything from air pollution, increasingly mouldy houses because of floods and water damage. Toxic also means exposure to chronic psychological and emotional stress, sleep deprivation, excessive time spent sitting down, even if you get up and go to the gym on a regular basis, ultra-processed foods, one of the biggest toxins, loneliness, loss of meaning and purpose, and not least of all, the ageist culture we live in. And all those things are both independent and synergistic risk factors for developing dementia. And the other thing to note is that type 2 diabetes, obesity, cancer, depression, they all also independent, not so much cancer, but type 2 diabetes, obesity, depression, cardiovascular disease are all significant risk factors for dementia, particularly Alzheimer's disease. I mean, type 2 diabetes doubles your risk. Visceral obesity, that is a waist circumference of over 80 in women, over 94 in men, already starts to increase your risk. But, if you're massively obese, then that can also double your risk. And it sends the message that everything is interconnected. What's good for the heart is good for the brain, is good for the gut, is good for the soul.
I think that's really interesting.
So basically, I think we're living in a whirlpool of dementogenic agents, and the fact that not everyone gets dementia is a testament to the inherent resilience of the human brain and body.
So I guess for practitioners, when they have a patient coming in that's got insulin resistance and hypertension and obesity, and the patient may not even realise that those factors are increasing their risk of dementia, right?
99% of patients have no idea that increases their risk, and it can be added motivation. It depends on the patient. Some people are motivated by doom and gloom, and some people are overwhelmed by it. So I pick my patient carefully what I tell them.
Yeah.
I tell them what will empower them rather than what will just make them throw in the towel. Yeah, but 99% of people have no idea that high blood pressure, type 2 diabetes, insulin, even insulin resistance, fatty liver disease are all risk factors.
And is that, with those happening, like how does that increase the risk of dementia?
It's because, firstly, the most critical problem in Alzheimer's and most other dementias is cerebral glucose hypometabolism. In other words, there is a brain energy deficit, and this can clearly be seen on FDG PET scans, fluorodeoxyglucose, so radio-labelled glucose. I think it was in late 2022, a Medicare rebate was introduced for FDG PET. I think it's $700. It requires clinical evaluation by a specialist or a GP in consultation with a specialist. So if the brain is not using glucose as well as it should, that is the key problem in Alzheimer's. So now, next question, why is there glucose hypometabolism? It could be that not enough glucose is reaching the brain because of decades of high blood pressure, arteriosclerosis, heart failure, stroke, or problems with glucose transporters in the blood-brain barrier. It could be due to hypoxia secondary to traumatic head injury or stroke, or it could be due to brain insulin resistance. Now, not all neurons require insulin for glucose to enter. It's not like the rest of the body. However, interestingly, the areas of the brain affected in Alzheimer's, particularly the hippocampus, those neurons do seem to require insulin in order to absorb glucose. And they've actually found intranasal insulin in trials has improved cognition.
Wow.
Yeah, so that is one area that is being hotly researched. And the other things that cause glucose hypometabolism are mitochondrial damage, oxidative stress, inflammation, and most likely a combination of the above. And all these processes then lead to the accumulation of amyloid beta protein plaques or oligomers around brain cells and phosphorylated tau, tubulin-associated unit, if you want to know, tangles within neurons. And both of these aberrant proteins interfere with synaptic transmission between neurons and lead to eventual neuronal death and subsequent brain shrinkage. That's about as simply as I can explain it. But the next question is then, well, why are we getting insulin resistance in the brain? Why are we getting mitochondrial damage, oxidative stress, inflammation?
And is that the diet and the lifestyle and the pollutants and things like that?
It's all of the above because, stress causes insulin, everything I listed, stress and air pollution and cigarette smoking and alcohol and poor diet and sedentary lifestyles, all of these things contribute to mitochondrial damage. However, I think the most compelling hypothesis, and it's been backed by very good research, is that probably the key driver of Alzheimer's is actually fructose, excessive fructose consumption. And the biggest message I want to get across to all my patients is that every soft drink is a bullet to our brain. So are most fruit juices. Why? Because sugar-sweetened beverages deliver a massive load of sugar to our liver in a very short space of time, and this has dire-metabolic consequences for our brain as well as for our body. So I'm just going to give you a very quick primer on the metabolism of glucose and fructose because this is really, really important to understand for why certain strategies are protective. So firstly, listeners will know table sugar, sucrose, is made up of two smaller molecules of monosaccharides called glucose and fructose. And these two molecules are metabolized very differently in our body. And I'll start with fructose because it's the bigger bullet to our brain. And I'm talking pure fructose. Let me just make the point that people go fructose, fruit sugar, berries and oranges and apples and bananas, all your fruit. Does that mean I have to quit fruit? No. When fructose is packaged with water, fibre, vitamin C and phytonutrients, all that mitigates the damage that fructose can inflict. It's only when you extract fructose, as in table sugar or any other refined sugar, that is when it causes damage because it loses its chaperones, fibre, water, vitamin C and phytonutrients that mitigate its damaging effects. So when you get it on its own, it easily enters the brain. And the first thing that fructose does is it causes, in the metabolism of fructose, it sets off a series of chemical reactions resulting in a drop in brain cell energy, ATP, which is the glucose hypermetabolism I mentioned, the hallmark of Alzheimer's. That then leads to increased uric acid inside brain cells where it is pro-inflammatory. That then sets off oxidative stress, reduced mitochondrial function, insulin resistance, and leptin resistance. And leptin is the hormone of satiety, and this is significant because leptin then resistance drives overeating because we never feel satiated, and we just go and eat more carbohydrates and refined sugars. The other thing fructose does is it also interferes with gene expression in the hippocampus and hypothalamus.
Wow.
All of the things I listed, all the major contributors of Alzheimer's and quite possibly the initiating causes. You know, all the research is focused on removing amyloid and tau from the brain, you know, all the latest drugs, causes very, very minimal reduction in disease progression. I mean, go out for a run. That does more for you, but we can talk about that more later. Amyloid and tau are necessary, but they come much later in the disease process. And it's the damage has already been done. They're just indications that something has been horribly wrong, but they're not the initiating causes. And so the major driver of Alzheimer's is looking more and more as a result of mitochondrial dysfunction in response to excessive brain fructose. And people will know mitochondria are the powerhouses or energy-producing organelles in our cells. They also have a huge roles in neurotransmitters, and they are found to be misshapen and reduced in number in people with Alzheimer's. And on a, you know, just in the lab, when you give lab rats pure fructose, just table sugar, their memory declines. They perform worse in maze tests than rats, you know, fed a diet without fructose. Interestingly, this is partially, but only partially, mitigated by simultaneously giving the fructose-fed rats omega-3 fatty acids. But it's not a get out of jail free card. It doesn't mean you can go on a sugar binge just because you've had a big piece of salmon for dinner. But it is really interesting to note that, you know, all the different aspects of our diet act in unison. There isn't one, you know, everyone goes blueberries. Yeah, blueberries are a good brain food, but they certainly don't act in isolation, you know. They're just part of the picture. So that's fructose. So I wanted people to understand why fructose is on my hit list and why particularly soft drinks and fruit juices, unfortunately.
What about fresh fruit juice?
Absolutely, because what have you done? You've removed fibre. Yes, you've still got the vitamin C, you've still got the water, but you're still getting a massive too high a dose of sugar to your liver and to your brain in a short space of time because you're just drinking water and sugar once you've juiced the fruit. And how much fruit goes into how many oranges in a small glass of orange juice? Minimum 4. How many oranges would you eat in one sitting? Rarely more than 1. So it's volume. So the poison is in the form that fructose comes in, i.e. liquid is the worst and refined is obviously damaging, not the whole apple, not the whole berry.
Yeah.
But also in the dose. Now let's have a quick look at glucose. Glucose, we do know, is clearly the major fuel used by our brain and our body. It does provide brain cells with energy. However, we also know that in excess, glucose leads to hyperinsulinemia and insulin resistance, which leads to type 2 diabetes, abdominal obesity, heart disease, and most of the chronic diseases of modern life, all of which we've already mentioned are independent risk factors of Alzheimer's. But here's the thing that shocked me the most, and this has been known for maybe not a decade, but at least 5 years, that excess glucose can be converted to fructose. And when I say excess glucose, that would apply to anyone eating a Western, the average Western diet filled with ultra-processed foods, refined starches, breakfast cereals, loads of bread, pasta, white rice. Okay, but again, in this case, we are talking excess. But here's the other thing. The enzyme needed to convert glucose to fructose is enhanced in the presence of salt, alcohol, dehydration, and hypoxia. So if you think about it, one of the worst things we could be eating is French fries, because that's pure glucose. They always have loads of added salt. That will convert it to fructose. Dribbled with tomato sauce, washed down with a beer, which is the alcohol, which adds to the ease of conversion of glucose to fructose. You are on a bullet train to Alzheimer's if French fries washed down with a beer, drizzled with salt and tomato sauce is one of your staples.
Totally, yeah.
So a high carbohydrate diet in association with a high salt diet and a few glasses of wine is just massively bad. Now, if somebody does not have Alzheimer's or dementia and they're just, are healthy and want to know about prevention, I just simply say to them, my number one dietary message is simply to eat real, whole, unadulterated food. You can eat any food that agrees with you. All you have to do, and this is the difficult part, is ditch the junk food, fast food, convenience foods and ultra-processed foods that fill 80% of our supermarket shelves. Now, this is so not news to our listeners. It doesn't matter if you're vegan, vegetarian, omnivore or carnivore, as long as you eat food that is from the land, from the sea, from the sky or from a tree. Not from a packet, not from a tin. If it comes in a box, I'd throw it in the bin. Of course, it is more nuanced than this, but if in doubt, give the product a miss. Now, as I said, everyone listening to this knows that ultra-processed foods are toxic. But in my clinical experience, the challenge with this is twofold. Firstly, most people don't know what real food is. They only associate ultra-processed food with fast food, lollies, and your obvious snack foods. It comes as a real shock when I list breakfast cereals, most supermarket breads, frozen meals, all sauces, most salad dressings, fruit juices and flavoured yogurts as ultra-processed foods. And secondly, even if they realise this, most people don't like the answer because they can't imagine they could live in the modern world without ultra-processed food from both a taste and logistic perspective. They would much rather not eat meat or gluten or dairy or lectins or their preferred villain, because then they can still find super tasty, addictive snack foods that fit into their chosen picture. And it means they don't have to cook everything from scratch every night. And it's about educating people that it doesn't have to be complicated. What we're fighting against, all of us in this health space, is that multi-billion-dollar food companies are marketing toxins as treats. So somebody like me just sounds like they're off on this anti-sugar bandwagon, and we've been eating sugar for decades, centuries we have, but not in the amounts that we are now eating.
Yes.
So sorry that, I'm sort of going on, but I just think it's such an important point that if somebody has Alzheimer's and they cut out all sugar from their diet, there is another good book I can recommend, Dale Bredesen, Survivors of Alzheimer's. When they go on an ultra-low carbohydrate diet, a ketogenic diet, they can regain, not just halt or slow decline, they can regain cognitive functioning. And that is amazing. And not to put people off, the ketogenic diet is really in vogue and everybody can lose weight on it, and they don't necessarily. But I don't see a ketogenic diet as a fad diet. I see a ketogenic diet in the same light as I would see a gluten-free diet for celiac disease. If you don't have celiac disease and you don't have gluten sensitivity and you're okay with it, doesn't seem to not agree with you, then you can eat some gluten.
Yeah.
So if you don't have insulin resistance, sure, you can eat carbohydrates. Not to excess, because as we age, we do actually are less tolerant of carbohydrates. We become less insulin sensitive. A ketogenic diet, and it's part of what I call neuroketotherapeutics. It's a therapy. It's an intervention, because ketones, which are produced in the liver from fat when there's no glucose or insulin in our bloodstream, ketones are neuroprotective. Number one, ketones are the only alternative fuel source that the brain can use. Now, remember, the brain is not using glucose, but when tested, the brain continues to be able to use ketones as fuel. So ketones can make up that glucose deficit in our brain and provide our starving brain with the energy that it's not getting. But ketones also reduce inflammation, reduce oxidative stress, reduce amyloid beta levels, enhance mitochondrial function, and increase brain-derived neurotrophic factor, BDNF, which we know stimulates synaptogenesis and neurogenesis. And it is one of the reasons that exercise is such a powerful factor in improving and protecting our brain from decline. So as you can see, all the effects of ketones counteract the destructive processes that occur in Alzheimer's. When I wrote the book, there were only 2. I think there's now at least 4 studies on the ketogenic diet in patients with, MRI, clinically and radiologically diagnosed Alzheimer's, when they go on a ketogenic diet, and they've only been short trials, most of them no more than 3 months, they actually found that the ketogenic diet enhanced cognition. This is better than the new whiz-bang drug lecanemab, which only slows disease progression by 27% at best, in 18 months. But this was already, in a couple of months, the ketogenic diet enhanced cognition and improved daily functioning and quality of life in at least 3 separate, completely independent studies.
Incredible.
And if you want, listeners will just love this, go to Dr. Matthew Phillips' I think it's metabolicneurologist.com. He, for free, allows you to download what he calls his metabolic strategy plan. Go to resources, scroll down. It is the exact diet he used in his study. And it was made really easy. It's even a modified ketogenic diet because it allowed artificial sweeteners, because people with Alzheimer's crave food, and it's really, really hard to get them on a ketogenic diet. So practitioners can just take this and use it.
Oh, we'll link to the show notes for sure. That sounds really interesting.
Please do.
So in your book, you mentioned the cognitive reserve hypothesis to describe how adventure can prevent dementia. Can you tell us a little bit more about this?
Cognitive reserve was coined quite a few decades ago when it was found that there are people at autopsy whose brains were riddled with amyloid plaque and tau protein, tau tangles, and yet they were completely free of any Alzheimer's symptoms. And so it was postulated, and what they seem to have been doing is that, yes, some of their brain was compromised, but they seem to be able to make alternative pathways to fulfill the same, to make up for the deficits. And it seemed to be that people with a higher education, with less stress, with more stimulating jobs, more social engagement, lifelong active learners, these were the people that seemed to be able to buffer the effects of amyloid and tau. This is really positive because what it's saying to us really is, you might even have pathology happening, but there are so many things in your life that you can do. Diet confers cognitive reserve, exercise, music, art, complex literature, reading Shakespeare, whatever you enjoy doing that challenges you, but not to the point of overwhelm. They do studies on older people and younger people, and you give younger people things to do on their computer and it's like easy. It doesn't actually stimulate any growth of new brain cells or new connections because it's second nature to them. But you give it to somebody, in their 70s and 80s, digital photography, it is one of the biggest brain boosters because for them it's a challenge. So it's very much a personal thing. What do you find, enjoyable? Because if you don't, you're not going to enjoy it and you're not going to keep up with it. But also you don't want it to be stressful because that counteracts the positive effects. You want it to be just challenging enough that you're really keen to try and master this. But it doesn't even matter if you don't master it. It's the striving that matters. It's the trying. It's the putting in the effort. It's the cognitive effort that seems to bring in the most benefit.
Yeah, and I think that's an important question for practice to ask their patients, because we ask so much about diet and systems-based questions, but, you know, I think you say, what is something you've always wanted to explore, do, study, but never did? What are you a little bit fearful or curious about trying? Like, give it a go.
Yes.
Like, essentially like a bucket list, which I think is a great idea to add into the consult forms for patients.
Yes, and having that adventurous spirit. I tell people, you know, dementia is a starting point. It's not an end point.
Yeah.
You know, it devastates me how many people I get coming back from neurologists, geriatricians, who describe their experience as diagnosed and adios. Look, sorry, just get your affairs in order, because really there's nothing we can do. The few medications we have may alleviate a few symptoms temporarily, but the minute you go off them, you'll decline to where you would have been had you never taken the medication in the first place. I mean, you know, rates of suicide in the 2 years post a diagnosis of either MCI, mild cognitive impairment, or dementia, you know, skyrockets. 44% increased risk after dementia and nearly 70% increased suicide risk after MCI.
Is that because of the disempowerment?
They're given such a hopeless message. But so I say, look, dementia is simply a signal that something in our life needs to change. Everyone knows that Einstein quote, if you keep doing what you've always done, you'll keep getting what you've always got. I mean, I'm very quick to point out that this is not about blame. Nobody consciously chooses to get dementia, and it can happen to the most health conscious of individuals. But if you have a dementia, it is a call to re-examine every aspect of your life, because if you don't, this will rob you of your life. And if it were me, first and foremost, I would ask myself, where am I not happy in my life?
Yeah.
Is there anything draining my joy, enthusiasm, or energy? And that is where I would start to implement changes for the better, no matter how small, because we could do a whole podcast on how joy in itself is healing, no matter what disease you have. Joy strengthens our immune system, our cognition, our cardiovascular system. I had a very I always get tearful when I think about this patient. She was diagnosed with MCI, and we had this conversation. And 6 months later, she came back and she said, you know what? My diagnosis has been a gift, because it's finally given me an excuse to look after me and to pursue a long buried passion she had. It was just getting singing lessons and composing music. But, you know, she spent her whole life looking after her children, her partner, her own parents. And she said, you know what? I've actually never been happier.
So this is kind of what you talk about in your book, about how beliefs influence biology, right? So often patients identify with the labels and diagnosis they've been given, and so when you give someone a diagnosis of dementia, it can be all doom and gloom essentially. But if you emphasise that a diagnosis of dementia could be a doorway for a healthier life if they approach it in a different way, then it could be a catalyst for change and opportunity for growth and doing what you really want to do in life, right?
Oh, yes. And I have so many dementia patients who have become activists for greater awareness of disease risk factors, who've become involved in research, who've started to challenge the ageism that is so rampant in our society that we don't even realise it. Let me just mention one study which just blew my mind, and I went back and read the fine print and all the graphs and all the raw data because I just couldn't believe it. But it's been backed up by other research since. This was started in 1968, and it was researchers from Yale School of Public Health in the US. They questioned 386 healthy men and women with an average age of 36, so they're still young, so they're at 36, on their attitude to ageing. And they did so by asking them how much they agreed or disagreed with statements such as you get old, you become less useful. Old age brings increasing aches and pains. Things go steadily downhill as you age. Okay? And they had to rate it, 1 to 5. So 1, totally disagree, 5, 100% agree. And I might even just pause and let listeners think, how much do you agree or disagree that things go downhill as you age? As you become old, you become less useful. You become more helpless. You lose independence. What do you think of those statements?
Well, I totally disagree, but I think when I'm around my parents, they say things like, oh, we're just getting older. And I met someone in their 40s at the weekend and he said something like, oh, it's just because I'm getting older. And I felt quite irritated because I actually disagree with that.
Yes. So anyway, they then followed the participants for 38 years.
Mm-hmm.
And in that time, okay, so now they were in their mid-70s, a lot of them, if not older, depending on their age at the start. So 38 years later, 70% of people who strongly agreed that things would go downhill as they age had suffered a heart attack, stroke, or some other serious cardiovascular event, compared with only 15% of people who didn't think that things would go downhill as they aged. And this was after ruling out known risk factors for heart disease like family history, smoking, type 2 diabetes, and visceral obesity. That blows my mind. If there were a drug that reduced our risk of cardiovascular disease by 55%, from 70% to 15%, we'd all be taking it. And it turns out that the first step to aging better is to feel better about aging, that one of the most important things we can do to reduce decline and to improve brain function and not get dementia is to just let go of our ageist, limiting beliefs.
Yeah.
So I give all my patients 2 pieces of homework in terms of, just at any age, at some point, I say, how do you feel about getting old? Is it something you fear? Is it something you dread? Do you associate it with freedom? Do you associate it with frailty? And next time you come in, I want you to write down, between now and the next time you come in, I want you to list all the things that are good about getting old. You care less about what other people think or, whatever. What do you think might improve as you age? And secondly, go and watch the YouTube clip of acrobatic salsa dancer Patty Jones.
I've seen her.
Who is in her mid-80s and still touring the world as an acrobatic salsa dancer with her 40-year-old partner, Nico. And she says she'll only stop dancing if Nico gets tired of throwing her into the air. And before you say, oh, yeah, but I'm too old to start salsa dancing, and I'm not saying everyone has to start salsa dancing, Patty started salsa dancing in her 70s after her husband died because she didn't want her life to become meaningless. She needed to find something, and that was always something she wanted to do. So we need to surround ourselves with more positive role models because terrific. If you want to read more about all these studies and all this stuff, Ellen Langer, Langer, she's written so many books. Counterclockwise is probably my favourite. And basically what she has found is that we are taught to age by the culture that we live in and by our family. So the biggest predictor of healthy aging is having sprightly grandparents. And it's not genetic. If you grew up and your experience of grandparents was the only experience you had was visiting them in a nursing home, that is your picture of aging. That is what you unconsciously expect. Whereas if your experience of your grandparents was postcards from the Bahamas, different place every week, they're on cruises, they're travelling, they're playing bridge and mahjong and going out to luncheons and literary talks, then that's how you expect to age.
Yeah. So what you're saying is one group of people has a sense of purpose, right? And social connections and the others don't, maybe. They associate aging with decline and lack and fragility.
They focus on what they lose with age. Oh, I've lost all my friends. Well, make new ones. Make younger friends.
Yeah. And I think this is, as you said, it's very much highlighted in the research. Sense of purpose halves the likelihood of Alzheimer's disease, which is incredible, right? So with our patients then, we want to be asking about their sense of purpose, their reason. I think, the Akina ones call it the ikigai, the reason for getting up in the morning. So then I think you got your dad doing volunteering, right?
Meals on Wheels, yes. We were the dad and daughter team.
Yeah, tell us more.
Well, the reason I did that was because I read a study that volunteering actually changes the structure of our brain.
Wow.
A group of older women in the US, they were I object to the term older women, but that's what they call them. They were over 50. They were invited to help primary school children with literacy. They'd all shown possible signs of some waning memory. And they had functional MRI scans of their brains before and after 6 months of volunteering for just 15 hours a week. So, a couple of hours a day. After half a year, volunteers not only performed better in memory tests, they actually exhibited increased activity in their brain, in their prefrontal cortex.
Wow.
And they just showed there was greater vascularity. It was almost like they'd sprouted new blood vessels in their prefrontal cortex. They were getting more delivery of oxygen and glucose. Wow, how phenomenal. And that was because they had engaged in something meaningful. There was another study, it was a 4-year study of more than 6,500 Americans. They were also aged over 50, showed that people who volunteered for 200 hours a year, which is not a lot, 200 hours in a year, they were 40% less likely to develop high blood pressure than those who didn't volunteer. And another study found that similar amount of volunteers, like 40-something%, were less likely to die during the 4-year research period, like if you volunteered versus if you didn't. Older adults who look after their grandchildren demonstrate sharper mental acuity. And I think too, so these are all, it's like, yeah, let's do something that we can do. So, I was the driver, Dad was the runner, and it was so good on so many levels because it made him realise that there were a lot of lonely people out there, because for some people we were their only social contact for the
100%.
day, for the whole day.
That's what the research shows, that when people, with the Meals and Wheels, the people receiving those meals, it wasn't the meal that was the best bit of the day. It was the engagement they got with the person delivering the food, which I think is astounding, right?
Absolutely. And I think volunteering also leads to less depression.
Because we're being of service to others, right? And maybe as humans, that's what we're meant to be doing, interacting with each other and not being lonely. Because I think poor social engagement, loneliness is associated with approximately 55% increased risk of dementia. So we wouldn't necessarily think of volunteering as being adventure, but essentially it is.
Oh, yes. Do you know the most cognitively challenging thing we can do is meet a new person or just in social contacts, because we just underestimate how much. Okay, when you're talking to somebody, number one, you've got to remember who they are. You've got to remember things about their past. You might be talking about things in the news, so you're bringing in that information. You've got to read body language. You've got to decide, are they being sarcastic? Are they being supportive? Are they being funny? There's just so much information coming in at a very fast rate that you have to assess. It is a huge way to stimulate our brain. But the key to everything, whether it's exercise, whether it's volunteering, whether it's socialising, is to do as much as makes you feel good. Once it becomes a chore, it loses its magical properties. So if, I tell people, how much should I do? Well, as much as you want. But once you start feeling that it's a stress or an obligation, stop. That means you're doing too much. And the other point I want to make is the type of volunteering also plays a role. Like research has compared the effects of what they call other-oriented volunteering versus self-oriented volunteering. And what that means is other-oriented volunteering means that you are doing something that directly helps another person, and it's face-to-face interaction with the recipient of your help. Self-oriented volunteering is, maybe you're doing admin, or maybe you're doing the accounts.
I see.
Or clerical stuff, or maybe you're volunteering so you can gain skills or work experience. Both forms of volunteering do lead to better physical and mental health, but the other-oriented volunteering has way, way greater benefits in terms of, life satisfaction, subjective well-being, sense of belonging.
Yeah, okay. Now, you mentioned physical activity and the benefits of physical activity in dementia. Tell us more. Okay.
People sort of roll their eyes when they hear about exercise, because everybody knows we should be exercising, but I think we need to tell them to be very specific. There are specific suggestions I give everyone around exercise. Number one, some kind of endurance training, aerobic exercise. Now, in your over 65-year-old patients, the goal is to be able to walk 360 metres in 6 minutes or less. That is 1 kilometre in 16 minutes or less. And people love to have goals. And I said, don't worry, if you're slower than this, it is a goal to work towards because speed does matter. The faster your walking pace, the healthier your heart and your brain. And but it could, so basically 150 minutes of aerobic exercise, the standard guidelines are fine. The more intense, the better. The hits are fantastic. And okay, so let's say, but it could be swimming, it could be running, it could be playing tennis. Tennis is a great, intermittent, high intensity exercise. It could be riding a bike, it could be dancing, whatever you enjoy doing. And the reason aerobic exercise is so powerful is it reduces inflammation. It improves mitochondrial function. It helps to strengthen and repair the blood-brain barrier. It stimulates the production of BDNF, which we talked about earlier, brain-derived neurotrophic factor, which stimulates synaptogenesis and neurogenesis. And, they've done studies there's so many studies on exercise. I mean, we could talk about that all day. But, just 30 minutes in the US, they found that the best way to improve a child's exam scores, and some schools are doing this now, is before their exams they have to go for a mile, walk or run because they're mile. So you run that mile or you walk that mile as quickly as you can, then you sit down for your exam and the results are better.
Wow.
Because they've produced BDNF.
Yeah. BDNF blows me away that, we can exercise, increase it, it's stimulating neuronal growth, increasing neurotrophins, decreasing inflammation, oxidative stress. I think so many patients come in and, as you said, we know we should exercise, but so many people struggle with it. And when we're getting patients to exercise, I wonder if they know just how much it's improving their cognitive health. And I think
they don't.
But if we explain these benefits, maybe they'll be more inclined to actually to do it. I think a lot of patients focus on exercise for weight loss without really understanding how it affects the whole system. And then specifically with patients that have dementia, I was really interested in a lot of studies that showed that it reduced their depression and reduced their falls as well. So the benefits are not just cognitive, they really are systemic.
Oh, definitely. Look, exercise is better than Prozac. It is better than any antidepressant on the market, but you really need to be consistent and do an hour a day, and you have to add strength training, which I'll talk about in a moment. I mean, I just say to my patients, movement is medicine. It's not about weight loss. I don't care how many calories. It's not about the calories. It's about the effect on your brain. I said, I go to the gym for my brain, not my body. I mean, it's great that my body benefits as well, but it's more for my brain. And I tell them, why don't you just start with exercise snacks? I mean, there's a fancy word for it, but I can't remember the fancy acronym for it. But it's even just 6 seconds. Oh, the bus is there. I'm going to miss it if I don't run. Running that 6 seconds to catch the bus improves mitochondrial function. Running up those stairs, just if you've got a couple of minutes at work where you get a break, just, go outside and just run around the block. But we're talking a mere 6, 10, 30 seconds of exercise is useful, like as often as you can throughout the day. So I say, let me tell you, the best snack you can have, an exercise snack. So that, and I just say it's not a nice to have. It is a must have if we want to maintain and improve brain function. And for listeners, the health practitioners, you're going to start to hear a lot about lecanemab, I suspect, because it is the latest whiz-bang, anti-amyloid drug. And as I said, it reduced the rate of cognitive decline by 27% at 18 months. It did not, but it has side effects, cerebral edema, microhemorrhages in more than 30% of patients. But here's the thing, it does not stop the disease, and it certainly doesn't improve cognition. It just kind of slows decline a little bit. Exercise, in contrast, actually increases the size of our hippocampus and improves cognition and all parameters of quality of life measured. Why are there no big headlines about, we should have it splashing across every newspaper headline, go for a run, a swim, a cycle, a jog, a dance, a game of tennis. This, we're just not getting the message out there powerfully enough. It's, people hear about exercise and they roll their eyes, but I just think we need to be clearer
Mm.
the specific benefits.
Definitely. Now let's talk about grip strength, because you were famous when I met you last year in Melbourne with those amazing arm muscles, and you were talking about how grip strength could predict Alzheimer's disease and dementia risk, and just how powerful doing the exercises was for that. Can you tell us a little bit more?
Absolutely. I think strength training is just as important. I mean, some will argue that it's more important. I think they're equally important. Okay. So by strength training, it means we have to do some kind of resistance training to maintain our muscle mass. Because if we do nothing, from our mid-30s onwards, we lose minimum 5%, easily 8% of our muscle mass every decade. That's if we do no strength training. So if you do the maths, from our mid-30s to our mid-70s, we could have lost at least a fifth of our muscle mass. Sarcopenia. Now, why is this a problem? Well, obviously because sarcopenia leads to frailty, increased risk of falls, fractures, poorer balance, just lower quality of life. You can't open a jar. You can't carry your shopping around, whatever the case may be. You can't even hang up your washing if you're weak. Okay. So that's the first thing. Secondly, everyone knows about the two-way communication between our gut and our brain. There is equally important communication between our muscles and our brain. When we exercise, our muscles produce hundreds of myokines, which, you know, some of them are neurotransmitters, but basically these are chemicals that keep all our organs healthy, including our brain. And when you test somebody's grip strength, assuming that they haven't recently had hand surgery, it tends to reflect overall muscle strength, which reflects cognitive strength. People with stronger hand grip strength perform better in tests of memory, cognition, executive function. They just do. Because the other really important thing is the more muscle mass you have, the greater the glucose sink you have, the more insulin sensitive you are, the less likely you are to become insulin resistant, get type 2 diabetes and all the corollaries of that.
So muscles release myokines, which strengthen the brain, because the brain's a muscle too, right? No.
No, but it can in some ways act like a muscle, use it or lose it. The more we engage our brain, the more different ways we engage our brain, the bigger, the more complex and the more effective it becomes. So it's the same as our muscles. And different cognitive exercises confer different cognitive benefits as well. So, they are very analogous to muscles.
Excellent.
The third component of exercise, though, is, by the way, if you just want to know some numbers, there was a study on US firefighters, thousands of them, and they found that those who could do 40 non-stop push-ups halved their risk of cardiovascular disease and mortality compared to people who were not able to do 10 consecutive push-ups.
Okay.
So now I know that's a tough goal, but great. I mean, if it's not hard to do, then it's not going to do us much good, is it?
Yeah, and that's just practice, isn't it? Just with the push-ups, it really is just building up your strength.
Start against the wall. Start against the wall. Then move down to the floor on your knees, and then if you're really brave, get onto your toes.
Yeah.
But the third component, and this one tends to be overlooked, is balance training. Being able to stand on one leg with your eyes closed for 30 seconds is really critical to good cognition and mental health, because very interestingly, balance is largely controlled by our cerebellum, which also regulates our thoughts and emotions. And they found, a characteristic of people with schizophrenia, depression, anxiety, and dementias, they all have poor balance. And when you improve their mental health, their balance improves, and vice versa. When you improve their balance, their mental health improves.
Wow.
So that's an easy one.
Yeah.
Dad and I would always be standing at the supermarket aisles, on one leg. And I know people thought we were just crazy. And I just thought, you know what, it doesn't matter. That is one of the benefits of age. I don't really care what these people think of us. They just sort of thought we were just mucking around, father-daughter.
I feel the need to practice. I'm sure everyone listening is absolutely trying to stand on one leg at the moment.
Yes. And, of course, that goes hand in hand with reducing sitting time, because even if you flog yourself at the gym for an hour a day, it doesn't counteract the negative effects of sitting the rest of the 11 hours. Because, basically sitting for 11 hours a day increases your risk of early death by about 40+%.
Gosh.
Sitting compared to someone who sits less than 4 hours a day. So it's dose dependent, and if you sit for 8 hours a day, the increase is 15%. And all you need to do to counteract that is to stand for 2 minutes every 20 to 30 minutes.
On one leg.
And all my lawyer friends just break out into cold sweat because every 6 minutes is a billable unit, and it means every hour I'm losing a billable unit. And I go, you can still read. I'm not asking you to do star jumps. I'm just asking you to stand up. That's all you need to do. Just stand up, a bit of a stretch. You can still be reading, talking on the phone, doing work. But we've got to break up that sitting time, because if we don't sit, we just get a build-up of inflammatory cytokines causing chronic inflammation.
That's a really easy thing. I mean, I'm saying it sounds easy. I also sit for very long periods, but it's something practical, easy for us to do very much.
Just a habit. It is just becomes a habit. I mean, writing that book, how much sitting time do you think that involved? Well, I went to Officeworks and just got myself a $30 standing. I put it on my desk and I put my Mac on my desk, and then I could just continue typing. And I just have my alarm that was just easy. I just had it go off every half hour.
Yeah.
So every half hour I'd stand up, and then I'd forget. And then the alarm would go off and I'd still be standing. Yeah.
So that's a good tip for practitioners to be able to give their patients, set an alarm to kind of train the brain to remember.
Yeah. And a good tip for the strength training, because the how is the hard part. People are going to go, I don't want to go to the gym. I don't want to engage. I can't afford a personal trainer. I don't know what to do if I buy weights to come home. Number one, there's a whole lot of body weight training that you can just Google and find online, so you can do it at home. And it can be interesting. But for my frail elderly patients, I give them all, from all these conferences, you get the stress balls.
Yeah.
So I have, a collection everywhere I go. I'm just stealing all the stress balls because I give them all away to my patients. I go, just increasing your hand grip strength makes a difference. While you're watching your favourite TV show, go and just squeeze this stress ball. But 20 times one hand, 20 times the other hand, and then thumb and each finger at a time. Can you do that? And tell me how, where you get to next time.
Okay. And that shouldn't hurt, right, doing that?
Oh, no.
No.
No, not at all. I mean, they go as hard as they can. I mean, you can go all out and get yourself the best piece of gym equipment, a $6 hand grip trainer. No, I just got it online. It's $6. You just squeeze this thing and then you increase the resistance as you get stronger.
Yeah, we can all do that. Okay, so what about sleep? Because we know in terms of protection that sleep is essential to consolidate memory, and there's research showing that it removes some of those amyloid plaques via the glymphatic system. What do you see with patients that have dementia in their sleep? Because I guess where I'm getting at, I knew someone that had dementia and their sleep was very much affected. They would be awake during the night, like they wouldn't feel tired at night, and then it was completely out of whack. So what do you usually suggest there?
Okay. Sleep and Alzheimer's, they've got a bidirectional relationship. The first thing I would say is, like everyone, any age pretty much, because it's so common, is I want to exclude that they don't have obstructive sleep apnea. Because I've also had several patients come in thinking, that somebody they spoke to, or even another doctor they spoke to, thought that they might have mild cognitive impairment. Nobody asked them about snoring and sleep. Turned out they had sleep apnea, obstructive sleep apnea. They got a CPAP machine, and guess what? Their MCI disappeared.
Wow.
So obstructive sleep apnea is a huge one because, you are not breathing hundreds of times during the night. So you're never getting into deep sleep, so you're never getting the glymphatic system working, doing its job. So I just want to flag obstructive sleep apnea is something I just stay on top of everybody.
So it's like a differential diagnosis.
Old, even if they don't look typical, like they're not overweight, they don't have big necks. So I always ask about snoring. Just as an interesting aside, I happened to find research that showed they did this study in, I think it was Switzerland of all places, that learning to play the didgeridoo, this was case control study, it wasn't blinded because you couldn't be blind to playing the didgeridoo, but they had half the participants learning. They all had obstructive sleep apnea, all sort of moderate. So half of them learnt to play the didgeridoo and half of them got a CPAP machine. And guess what? They both improved the same amount.
Oh.
So learn to play the didgeridoo.
What was happening there? They changed their breathing.
Because of somehow you're strengthening your neck muscles and your vocal cords. It's about the effect that playing the didgeridoo has on all that area around your neck and vocal cords, which helps to keep the airway open when you sleep.
How interesting.
Yeah, I found that fascinating.
What about light and things like that with dementia?
Sorry, I didn't sort of answer the question. But, yeah, definitely sleep deprivation is a huge risk factor for Alzheimer's. So people who have 6 hours sleep or less per night in their 50s and 60s are 30% more likely to develop dementia in their 70s than those who sleep 7 or more hours per night. I don't think it's a coincidence that both Ronald Reagan and Margaret Thatcher developed Alzheimer's disease because they both bragged that sleep was for sissies. I can get by with, 4 to 5 hours a night. So, yeah. So, and then, when a person develops Alzheimer's, the disease itself contributes to disrupted sleep and the situation becomes a self-perpetuating negative spiral. But the reason sleep is so important is because, as you said, when we fall asleep, the brain switches on its waste removal apparatus called the glymphatic system. And I just think that the process is ingenious. So during sleep, neurons actually shrink to open up spaces between them, and then cerebrospinal fluid is pumped along the spaces to collect the waste, such as amyloid, that is built up between brain cells. And then that's just delivered to our bloodstream via glial cells and promptly flush out. And even a single night of insufficient or disrupted sleep is associated with a 10% increased risk in brain amyloid beta levels. But the good news is if we then get a good night of uninterrupted sleep the following evening, we can clear the excess amyloid. But you can just see how ongoing insufficient sleep leads to ongoing increases in amyloid plaque and tau tangles. And sleep is also when the brain repairs DNA damage in neurons. And lack of sleep, contributes to brain inflammation. And, the other mechanism by which insufficient or poor quality sleep leads to Alzheimer's is by driving up heart disease, stroke, high blood pressure, depression, type 2 diabetes, obesity, all of which independently bump up our risk of Alzheimer's. And the other thing that blew my mind, 7 consecutive days of sleep deprivation will push a person's blood sugar levels into the pre-diabetic range.
Wow. So what
Not to mention that then we feel too tired and unmotivated to do anything like exercise.
So I guess supporting patients who are, because, I get a lot of patients who would love to sleep. They want to sleep, but they're having issues with their sleep, and we do all the things. And, say, for example, they have a baby or they just have a sleep disorder. Yeah. So there may be... What are you suggesting, like strategies like natural light exposure first thing in the morning?
Absolutely, yes, critical. I mean, this is why shift workers have a higher incidence of everything, of all diseases. Natural light in the morning, yes, following our circadian rhythm, eating at regular intervals, not eating late at night, all the usual sleep hygiene. Some of the ones that people may not be aware of are, even if somebody says to me, but caffeine doesn't affect me, I can have caffeine late in the day and it doesn't affect me. Yes, it does. You can still fall asleep, but you'll never get into that deep restorative sleep. So cut out the caffeine from 1 o'clock onwards. So that's one. Secondly, alcohol. Yes, it helps somebody fall asleep, but it leads to rebound wakefulness 5 hours later. Thirdly, keeping the room cool enough. I don't like to be cold when I sleep. Have enough covers, but the room should be like no more than 19 degrees Celsius, because that makes a difference. Any light in the room can make a difference. So don't just, even having, the lights on digital clocks, or there's a bright street lamp outside and you can sort of see sunlight coming in between the curtains. Wear an eye mask if you really do want it super dark. At night, you really want to get that light during the day. A mistake some people sometimes make is they forget and they've got blue light blocking glasses and they might wear them during the day. Don't do that. But if all else fails, cognitive behavioural therapy for insomnia, CBTI, can be very, very effective. And sleep is so important that if they don't respond to all the usual sleep hygiene things that we tell people, then I cannot recommend this enough, because if we don't get your sleep in order, I can't get your eating in order. Because if you wake up sleep deprived, you wake up with higher than normal levels of cortisol, and we haven't even talked about how stress, cortisol attacks brain, cells in the hippocampus and will start to erode your brain function. So you're waking up with cortisol, which makes you hungrier throughout the day. So you're going to eat more and you're going to be hungrier for junk food rather than real food. Secondly, we wake up with lower than normal levels of leptin, so we don't even feel satiated when we do eat. Thirdly, we wake up with higher than normal levels of ghrelin, which is the hunger hormone. So sleep deprivation is a domino that sets off all other bad habits. So if I can't get your sleep in order, I've got Buckley's of getting your eating in order and Buckley's of getting you motivated to exercise.
Yeah, so true.
And you're ratty and your relationships suffer because you're moody and your partner says you're not nice. So that is one of the first things I focus on. Like, let's not move beyond, because I'm just going to set you up for failure unless we get on top of your sleep. And I in my book I sort of list online programs. Matthew Walker is a really good one.
Yeah, we like him.
He's got an online program. But just find somewhere to do CBTI for you, cognitive behavioural therapy for insomnia. That's a huge one.
So you've talked a little bit about some of the medications, but what about supplementation with nutrients? Do you use those much?
I go to supplements last for several reasons. One, because the research is so equivocal. I can find you, an omega-3 studies that will show you'll turn into an Einstein if you take omega-3 supplements. And then I can show you equally omega-3 studies that show you that they don't make any difference at all. So that's one thing, but I will talk about a few others. But the other reason I don't like to focus on supplements is because the minute I mention supplements, it's like, oh, good. Then I'll focus on the supplements and maybe I can get away with not doing as much exercise and not eating as well because I'm taking these supplements. The supplements are supplements. They are so much the icing on the cake. If you are chronically lonely, and loneliness is as damaging as smoking, some obscene number of, I think 50 cigarettes a day, something like, not maybe 50, but 20, some obscene number of cigarettes a day. So loneliness is as bad as smoking. So what I'm saying is, if you're lonely, if you've got a job you hate, if you're in an unhappy marriage, if you're getting bullied, all the supplements in the world aren't going to change that or improve your health to any measurable degree. So supplements come last. However, you don't want to let someone get B12 deficient, vitamin D deficient. Vitamin C is a good one, 500 milligrams twice a day, because it mitigates some of the negative effects of fructose. Magnesium L-threonate can help some people get a better night's sleep. Curcumin is one that I think has the greatest support. That's the active ingredient in turmeric. But make sure it's a supplement that has been specifically formulated to increase its bioavailability and preferably mixed with piperine, or just make sure you have some pepper with the meal and make sure you have some fat with the meal. Otherwise it's not absorbed. Yeah, so it's got to be the nanoparticles of curcumin, because they've done studies that have found that you just don't absorb it if the particles are too large.
And maybe that's why we see mixed results with studies, because of these types of products. I think there is some interesting research with Alzheimer's disease in curcumin where they found there was less decline in their function with curcumin use. Yes.
I mean, I take it. I use it as much as I can in cooking. I always add pepper, and I take a nanoparticle curcumin just because I don't think it's going to do me any harm, and it can only do me some good. The other one I think has got a lot of potential is MCT oil, medium chain triglycerides, because that's extracted from coconut oil, And the reason I think it's powerful is because your liver converts the medium chain triglycerides into ketones, providing those beautiful molecules that can feed your starving brain and have neuroprotective effect. Work up to 2 tablespoons, maybe 3 a day. Do not heat it, but start with, a couple of teaspoons, because otherwise some people can get a stomach upset. Drizzle it over salads. I add it to, after I've finished my mushroom stir fry, I will add it. After I finish scrambling my eggs, I will add it. So B12, vitamin D, vitamin C, omega-3, if you're not getting it in your diet. But the conclusive studies are people who eat more fish, that seems to be the thing, to eat it in real foods rather than take it as a supplement. Because you know what? Maybe omega-3 containing foods have something else in them, that omega-3 is a marker for something else. I mean, I don't think that is solely the case, because so much of our brain is made up of DHA. So DHA is a really important structural molecule in our brain. So I'm sure that there is something inherently good about omega-3, but it could also be the matrix in which it comes.
And what about folate? Because definitely the B vitamins are just so fundamental for neuroplasticity and methylation. I was reading an interesting study which showed that folate deficiency induces neurodegeneration. And I think, so many people aren't eating those folate-rich foods, the greens, the avocado, like you mentioned.
Yes. Look, again, definitely I would supplement it if necessary, but I just would rather somebody try to get it from real food.
Of course.
There was a really good, just showing you what was it called, the VitaCog study, the VITACOG, capitals. It was a 2-year Oxford University study, 70-plus-year-old adults with high homocysteine levels, which can cause brain shrinkage, and they also had mild cognitive impairment. It found that supplementation with high doses of B12, B9 and B6 slowed brain shrinkage and cognitive decline, as long as their omega-3 levels were not low. So this is another example of how things work together.
Synergy.
So definitely the B vitamins are super important, and if somebody does have high homocysteine, I do put them on vitamin B and omega-3.
I think testing homocysteine is so important. I actually had a patient whose test came up really, really, really high homocysteine. I've never seen it that high before, just the other day. So, pracky should definitely be testing that one.
And the other one that's underutilised is uric acid. Because high uric acid is a predictor of insulin resistance, cognitive decline, fatty liver, cardiovascular disease. It's almost a very, very early marker. I mean, way before you're going to get gout. So I always test uric acid as well.
Do you know what's really interesting?
It's not always elevated, but if it is elevated, it is a red flag.
So this patient, she had really high homocysteine and she also had really high uric acid. So that's really, really interesting. And she's young.
I'm not surprised. Like, for instance, I'm sort of going to pivot a bit because it just reminded me how really simple things can be really important. Make sure, midlife hearing loss is a huge risk factor for dementia. Therefore, I make sure that people get their hearing tested. And if it is compromised, get hearing aids. I don't know why people are so resistant to hearing aids.
That's my dad. My dad's got hearing loss and he refuses to get the aids in.
Hearing is so critical because, number one, it's a lose it or use it or lose it phenomenon. If you're not hearing properly, your auditory cortex isn't getting the stimulation that it needs. Your auditory cortex is therefore shrinking and losing connections between other brain areas, and it's a cascading effect. And also, if you're not hearing well, you become less confident, less capable in social settings, more withdrawn. It just has a cascading effect. So hearing is really, really critical, and we just got to normalise it. The second one is keeping on top of dental health, tooth decay, gum disease, because gum disease is a huge predictor of Alzheimer's. I mean, we know gum disease now is linked to cardiovascular disease and a whole lot, and rheumatoid arthritis and a whole lot of other conditions. One, because it can set off chronic inflammation. Two, because the bacteria that causes gum disease, Porphyromonas gingivalis, I mean, there's several, but that one in particular can actually travel to the brain and damage the hippocampus. And when they do autopsies on people, something like 90% of people with Alzheimer's have ginger pains, which are the toxins produced by P. gingivalis in their brains. And this is so important. There's actually Melbourne researchers are trialling a vaccine against P. gingivalis, and they're developing drugs to neutralise the damaging toxins. So if there's money going into pharmaceuticals, you know that this is important. So that's gum disease. So they're two easy ones. You know what I mean? Just hearing and gum disease. Another one is getting the shingles vaccine, interestingly, because although we haven't seen a link between shingles and Alzheimer's, we have seen a link between herpes simplex virus 1, cold sores, and Alzheimer's. And there seems to be a crossover effect that if you get the shingles vaccine, you have less reactivation of your HSV1. So preliminary studies have shown that can also be helpful.
Okay.
And the others, don't underestimate that their meds could, as we age, our kidneys and our liver are not as good at detoxifying ourselves. So the same dose of medication may be too high for a start. But secondly, I do an audit of everyone's prescription and over-the-counter medications, because a lot of them, they don't even realise, can have anticholinergic properties. Your antihistamines, anti-incontinence drugs, a lot of antidepressants, especially tricyclics, they have anticholinergic properties. And these have been now unequivocally shown to increase the risk of Alzheimer's. So I try and get all my elderly people off their anticholinergics. It is a bit tricky if they have urinary incontinence, but, we try and work around that. And, of course, I'd never prescribe benzodiazepines to anyone over the age of 60.
Because?
Because they dull your brain function massively.
They're used for sleeping though, aren't they?
Yeah, they are, but they shouldn't be.
Yeah, no, I agree.
And if you've got severe sort of anxiety disorder, something's just happened and you've had, where I would use a benzodiazepine, and only for a very short period of time, is, a woman's just recently had somebody break into her house. She feared for her life and now she can't sleep because she's so anxious. Okay, in that instance, I would give Valium for a very short amount of time and make sure we get her post-traumatic stress treated. But that's about I certainly wouldn't use them for sleeping, because prescription sleeping medications render you unconscious. They don't give you a good night's sleep. So, your body might rest, but your brain doesn't go through, the stages of sleep that it should. It's a bit like a chemical. If I smash you over the head with a cricket bat, you're going to be unconscious, but you're not asleep. You're unconscious. Well, giving a sleeping tablet is a bit like a chemical that whacks you over the head with a cricket bat. It renders you unconscious. Doesn't give you a proper night's sleep.
Oh my gosh, you're full of good, juicy information and clinical pearls. Thank you.
Great.
Yes. Thank you so much for joining us today, Helena. You provide us with so much inspiring and empowering information on a topic that so many people often feel very powerless dealing with. The key...
Absolute pleasure. I think the main message I want to get out there is, there is so much we can do throughout our lives to reduce our risk. It's never too early to start boosting your brain, but it's also never too late. So, start with all those general health measures throughout life. And even after a diagnosis of mild cognitive impairment or Alzheimer's disease or any type of dementia, we can still slow progression through everything I've discussed. We've both discussed the social interaction, the reducing stress, the physical exercise, the staying on top of their vitamins, the cutting out the fructose. Just so much we can do.
Now, where can people get your book? Where can we get our hands on it?
Any good bookshop. Also, any good bookshop, Booktopia, Amazon, but also my website, drhelenapopovic.com, or specifically my Alzheimer's dedicated website, Adventure Prevents Dementia.com. And I would recommend that everyone signs up for my Healthy Bites, which is once a week. I will give you the latest piece of research or something relevant to to help you boost your brain or pass it on to your patients. Like just before Easter, this is a topic in itself. So you'll just have to go to the website and read it because it's on the website. I did, a question I was asked was, is dark chocolate brain healthy? Well, that sort of led to a 600-word, answer. So go and read that. It's nuanced. Cacao can have cardiovascular and cognitive benefits, but by the time it's turned into a milk chocolate Easter egg, unfortunately not. but there's something in between that we can have and enjoy.
Oh, wonderful. Thank you, and thank you everyone for listening today. Don't forget that you can find all the show notes, transcripts and other resources from today's episode on the FX Medicine website. I'm Lisa Costa-Bir and thanks for joining us. We'll see you next time.
This podcast is intended as healthcare practitioner education only, and it is not a substitute for medical advice, diagnosis, or treatment.
If you enjoyed this episode, please take a moment to give us a rating and review on Apple Podcasts, Spotify, or wherever you listen to FX Medicine, and share us with your family, friends, and colleagues.